Hi, this is a presentation made by me, McKaylee Thurgood, talking about lung cancer. So you'll see on the right there's a picture of the comparison between a healthy lung and a lung that has lung cancer. And you can see that by the growth from the cells that have accumulated on the lung. So let's first talk about why lung cancer is something so important to talk about. Well, lung cancer is actually the leading cancer killer in both men and women in the United States. So it's a big deal and something that we need to be made aware of. So what is lung cancer? So first off, lungs are the spongy organs that allow you to breathe. So what happens is that cells in the lung change over time, often due to dangerous things that we may breathe. So what happens is our body tries to repair the damage, but over time, with repeated exposure, your cells are increasingly damaged. What happens after that is because there's all of these changes within the cells, it causes the cells to grow uncontrollably and form tumors. And the tumors then destroy healthy lung tissues, making it very hard to breathe. The symptoms that we may get you may see is someone with a new cough. They could be coughing up blood, they can have shortness of breath or difficulty breathing, or they could have chest pain. So what are the risk factors? The biggest risk factor is smoking. Smoking. Also secondhand smoke, so if we're around people that smoke. If you've had any radiation treatment, if you have radon gas exposure, or if you have exposure to asbestos, which are just cancer-causing substances, so that could be like arsenic, chromium, or nickel. And then also if you have a family history of lung cancer. So what I want to make sure you understand is smoking is the #1 cause of lung cancer. Don't smoke. Don't start. If you have started smoking, stop. It can save your life. You can see there that 90% of lung cancer cases are due to cigarette smoking. So I know that it is very addicting, but for those that are smoking, the best thing you can do is stop. And for those that haven't, the best thing you can do is never pick it up, because it really can mean the difference between life and death. Diagnosis. So if you do have lung cancer, some of the ways that they're going to diagnose it is they can get an X-ray, CT, which both of those are scans that are going to look in your chest, and they'll look for like some sort of mass, which would be all of those cells creating a tumor. They can also do a sputum test. So if you have a productive cough and you're coughing up like phlegm and stuff, they'll actually test that to see. And then they can also do a tissue sample. So you'll see the picture right here. It's called a biopsy. And what they'll do is they'll go in with a needle and pull out a little bit of tissue from your lung and test it to see if it has cancer. So how do we prevent lung cancer? Well, some of the ways is you can ask your parents if your home has been tested for radon. The big thing is don't smoke. We don't want to be around when people are smoking. We want to avoid carcinogens or cancer-causing substances. And then just overall, we want to exercise. We want to make sure that we're being healthy, that we're eating a good diet full of fruits and vegetables. Lung cancer tips. So even if you don't smoke, a lot of people will be like, I've never touched a cigarette. That's awesome. But you can still prevent it. Lower your chances by, like I said, eating vegetables, checking your home for radon, avoid secondhand smoke, and exercise regularly. Just because you don't smoke doesn't mean you aren't at risk. So doing these things help prevent the risk. And then treatment. If you do get lung cancer, some of the ways that they treat is you can do radiation. So they're going to use energy beams to destroy the cancer. They can do chemotherapy, so the drugs destroy the cancer, or they can do surgery, which they remove part of your lung, a lobe of your lung, or your whole lung. And that's the whole idea, is to get rid of the cancer. So that's the end of this presentation talking about lung cancer. Hope you learned about why it's important to be aware of lung cancer and the things you can do to prevent it. And here are my references.